Hi everyone, and welcome to our final CliniKids Autism Seminar series for the year. We are thrilled that you can join us. We know that this is an hour out of your time and we're really grateful that you're spending it with us. As we do with all of our seminars, we'll start with the acknowledgement of country and then we'll let you know what we're going to be doing today. So we're very lucky enough to be in Perth, which the traditional owners of the Whadjuk people of the Noongar Nation, and we acknowledge elders past and present, and we're in the beautiful season of Camberang, which is the Noongar word, the local dialect word for the season of rebirth, and it's just absolutely beautiful here. I'm so glad to be joined by my colleague and friend, David Trembath, who will be our host for today. So I'm going to throw straight to David.
Yeah, thanks, Andrew, and welcome, everybody. Thanks very much for taking the time. For this seminar, we're doing things a little bit differently. Generally, we set a topic and then we take people through sort of some information, some research, some information that's relevant to everyday life. But for this one, what we've done is we've put a call out for questions that you would love us to have a go at answering, and that's what we're going to do tonight. So we've organised them broadly into themes to try to make it a little bit cohesive, but there's quite a range of different questions and a lot of them. So we'll do our best to bring it all together and get through as many as we can as we go through some of these key topics. So we'll talk about assessment and approaches to therapies and supports. We'll talk about daily life and how strategies that can make life a little bit easier day to day, schools, and a couple of other topics. So yeah, what we'll do is let's get straight into it.
It's an AMA, as they say in Reddit. All right, that's what the kids say. Ask me anything. So let's hit it.
All right, well, let's start with assessment. Okay, so there's a lot of talk about assessment and how important assessment is, but also how challenging it can be to actually get an assessment for a child, a young person, or an adult. Mm-hmm. Do you think there'll ever be a time when it becomes more accessible? And what might it take?
Absolutely. Look, we're lucky to have been in the field for many years, and the blockages that we see at the moment with regards to access to assessments, they were not always this bad. They are terrible at the moment, upwards of 3 years for certain age groups to assess to get access to an assessment and diagnosis, and we see the key issue is that the imbalance between supply and demand, where we have increasing demand but quite restricted in terms of the need for assessment, but quite restricted supply in terms of the amount of assessors that are out there to actually service that need. Part of the issue, of course, that has been exacerbating this is that our systems have often used diagnosis or the presence or absence of a diagnosis to grant entry into the access of funding into certain schemes. Schools often use it, and we of course understand that the NDIS in Australia has previously used that. That is one thing that has sort of accelerated that supply-demand imbalance. And one thing that we've seen is that often the diagnosis becomes the ends rather than the means to the ends. And what we're seeing within the Australian ecosystem is that it's a reset to that. Diagnosis is absolutely critical to support kids and families. But what we absolutely know is that the most important thing is access to those supports. And so at the point at which diagnosis is a blockage to access and supports, it ceases to be facilitating the most important need, and that is the access to support. So we are seeing a reset within the sector to say that diagnosis is really important, but it's not the first step. The first step is getting access. Now, how do we then grant access? Who do we know? How do we know who should get access? Well, I think part of that is that we need to design our assessments and our assessment sessions much better, so we can ensure that we have sort of more prompt understanding of who a child is and how we can best support them. And that means allowing a greater funnel of children into our support system. So that's the key aspect. For me, it means resetting the purpose of the diagnosis to being a really important part of the pathway, but not the first part. That first part's that access.
Yeah. Well, I wonder if that goes to the second question. So one person's asked about how an educator should approach sharing their observations about a child with parents, including where there are signs that the child may have a developmental delay. And when I think about what you've just said, Andrew, to me, one of the of ways we could approach this is to really talk about that child's strengths and their needs. So less about sort of, possible diagnoses and so forth, really focusing on what an everyday looks like and any challenges they're having, but along with their strengths. And that can kind of be a gentler way to approach these types of conversations and straight away be working towards practical kind of solutions or ways to support that child and family.
I totally agree on that point, and it's about because it can be a really tough conversation for educators where they're observing something and how do they broach that? It's about identifying that common humanity, that we're talking about kids, and often when you start to introduce the concept of a diagnosis, we almost take the child a little bit out of it. But what you're saying, and I totally agree, is actually what is that shared humanity that we want for that child? We want the best. So it's about, have you noticed this in terms of their strengths and their challenges and their needs? Yeah,
absolutely. And there are a whole lot of different reasons why an assessment and I guess a diagnosis can be helpful or relevant, but they can be different for different people. I remember a seminar earlier in the year and you're looking at assessment and diagnosis, and I seem to remember you saying, like, for some people that will be really helpful in terms of learning a lot more about themselves and understanding themselves, and in some cases their identity. For other people, that assessment and or diagnosis can be really helpful for other people to better understand them. When it comes to planning and providing supports, that can work really well. One person asked us about late diagnosis. How could that possibly help a teenager about to leave school? Some of those.
Look, I think that's right. I've always conceptualized the purpose of diagnosis twofold. Let's say we're talking about a 5-year-old, where a diagnosis is both a backward-looking thing and it's also a forward-looking thing. So the backward-looking thing is around just understanding. It's helping that family and that child understand the pathway that they've been on to that point. This child is showing these behaviours that's best described by this diagnosis, which describes the path that they've been on across the length of that child's life. That understanding is so critical towards the connection with their child, the love that they share with that child, and the path that they will be going forward. And that goes to the next bit. It's about informing going forward. It's about how can this inform the best path for that child and how we can best support that child. Increasingly, of course, and so for the late adolescent, those things still apply.
Great.
Looking backwards is looking forwards. But what becomes increasingly prominent in older individuals is that identity piece. The idea that actually this is something about who I am, and I can identify with this, I can lean into this, however much people may want to, and I can use this for a sense of community, a sense of purpose, a sense of belonging. And that is the third sort of plank, or third leg of the stool that has been developed in terms of the purpose of the diagnosis.
Yeah, I agree. It's I see it help individual people, but I also see it help families connect and across generations, where people recognise parts of themselves in their grandparents or their kids and so forth. So that sense of understanding and identity can be really, really important.
Can I interrupt? Because it's time I asked you a question, all right? So neuroaffirming approaches, David, it's something that we hear a lot. What are neuroaffirming approaches? I'd love your take on this. And of course, we'd lean heavily on our autistic colleagues and friends on this. And what neuroaffirming approaches do you suggest, especially when working with social skills?
Yeah, certainly. Like it's a really hot topic, right? And for good reason. The national guideline for supporting autistic children and their families.
I know that one. Yeah.
You didn't go grave.
No, a little bit grave.
It's the first guideline nationally, internationally, to say that supports should be neurodiversity affirming. Important landmark moment, hey? But what does it actually mean? It's been interesting to listen to the conversations and watch the emergence of different sort of neuroaffirming, neurodiversity affirming supports and so forth in the community. What strikes me is that it's not really a set of practices. It's not like a recipe where people do 10 things and suddenly they're neuroaffirming or neurodiversity affirming. It seems to be much more of a principles-based approach, almost like a lens through which we through which we think about what we're doing, how we're working, what's it really doing or not doing for the people we're working with, and how can we change to make it even more safe and helpful and supportive. So when we take a principles-based approach, it becomes a lot easier, I think, to start to work or move towards that way. A little bit like, what are the other principles that we have? Child and family-centered, right? Mm-hmm. There's not like a 20 things to do to be child and family-centered. It's an approach to working that places children and families at the center of everything we're doing. So every time somebody describes an approach that's neuroaffirming, neurodiversity affirming, I think it helps us think about all the possibilities. But when it comes to an individual child or young person or adult we're working with, it goes back to that individual, really understanding them and their family and their context and personalising the supports.
Love that, mate. Absolutely love that. Can I put you on the spot? Because that was beautiful. What about, are there harmful or non-neuroaffirming practices? You've taught us about the beautiful neuroaffirming practices. One of the things that parents often ask is, well, I really want to do this, but are there clear no-nos out there? I don't know if this is one that you feel like you can answer.
Yeah, absolutely.
Yeah.
Like, my feeling is the way to approach this is not to kind of have a list of what is and isn't, but to really apply that principles-based approach, right? So if we say a therapy or support that we believe it should be individualised or child and family-centred, we then start to ask questions of whatever support we're accessing. It might be a support that's delivered in, an early childhood education centre or in a clinic or in the community or, in the person's home. The principle at stake there is it child and family-centred? Is it individualised? If we see the same thing being provided to all children, all families, without any kind of modification or tailoring, that's concerning. That's starting to go against that principle. So I'd say it's the same when it comes to neuroaffirming or neurodiversity affirming practices. If we have the principle at the heart of that it's really understanding the person for who they are, it's really about valuing them for who they are, celebrating their differences and diversity, but also recognising where they have strengths and where they have challenges, then we're in a good position to say, well, is this support consistent with that? Are people working in ways that really bring through people's strengths and get around them and support them? Or is it really focusing on their challenges, the difficulties, without those strengths? So that's the way I'd approach it. Some people are really keen to have a list. Things are in or they're out. My experiences have been, when you take any particular kind of type of support or approach, you'll see a whole spectrum in terms of how people deliver that. Some will deliver it in a really affirming, individualised way, and sometimes others won't. So take the principles-based approach.
I think it's a terrific explanation, and a really clear one for me as well. Hey, can we move on to daily life?
Yeah,
okay, these are the things that families ask us a lot, and are the real sort of rubber hits the road moments that we can think in the theoretical, we can think in the principles, but what about those kind of the rubber hits the road? Now, we have seen a greater shift to focus on how we can support, not just, here's a child with autism, let's provide, autistic child, hey, let's provide intervention, to, hey, here's a child who has these strengths and challenges, how can we support them within their daily life? And it's been a real shift. Why do you think that's important?
Yeah, I agree. It's, I guess, I've heard a phrase used a lot recently, and it's around, keeping kids close to their community. And we do that by ensuring that the fit between the child and the community is really tight. That is, the community is there and able to support kids to be part of everyday activities that we'd expect in childhood, in a particular culture and context and community. And that means doing really practical things to help make that possible. So I noticed we have questions. How about I just run through?
Rapid.
Really quickly. All right. Do you have any suggestions for clients who have difficulties with transition? So my feeling is transitions are all about understanding, comprehension. So if we support a person with a child, a client, child, young person, adult, to understand what's happening, what's about to happen and what will happen next, support comprehension, anxiety reduces, and the transition becomes a lot easier. I often say, think about a transition that goes really well, and then what helped make that go really well, and then try to replicate that in times where it's more challenging.
Can I just build on that? That's the answer. This is just to build on, is that, you know, people often ask what to focus on in schools, and it's the same in daily life. You know, communication, so people can understand and communicate their desires and needs, emotional regulation, so they're in that zone of learning, everything else beyond that, communication, emotional regulation, beyond everything else beyond that.
Yeah, isn't it interesting? It's very much about, you know, feeling safe and kind of at peace with that environment and that situation.
That's what I want.
Exactly. That's exactly it, isn't it? Sometimes the simplest answer is to step back and think, what would every child, every young person, every adult want? But what might we need to add or do differently in order to kind of bridge the gap where a person is and where they want and need to be?
Beautiful.
So what about how to get rid of the phobia of climbing up and down through the stairs? I think this is where, you know, there's a gap between the stairs, and that can be really challenging. Look at loads of kids in particular where this is challenging. I try to, again, think, are there times in life where stairs aren't a challenge? You know, so that's the first step, so to speak. I didn't mean to say that. But thinking about it, is it just one set of stairs, or is it every situation where there's a gap? Because it could be something else in that environment. Open stairs in a really noisy, echoey stairwell, it might be more about the sound than it is about the actual kind of the visual aspect of that. But let's assume it is consistent across places. Then we start to think, okay, what can we do with the environment? Are there practical things that we can do to make that easier? So we might say, is it possible to fill the gaps with cardboard? You know, does it really matter if we fill the gaps with cardboard for a while? Kids generally become more kind of flexible and able to, you know, approach these things as they grow. Or alternatively, maybe it's a sheet. Get a bed sheet, put it up and down the stairs, and suddenly that staircase looks a lot more kind of manageable. And gradually just move that sheet to the side over time, or go down the stairs instead of up. These sort of environmental, practical things can be quite helpful.
I'm glad you didn't say just get a lift. That would have been an expensive thing to say. Yeah.
I think that'd be a hit with lots of people. Then you don't get to slide down the stairs on a mattress.
That's true.
I don't know if you ever did that.
Oh,
That's
of course.
Definitely what my kids have done plenty of times, and maybe the adults as well. How do you increase concentration span and develop seating habits? So when I think of this question, my mind immediately goes to saying a child who at home might sit for a long period of time really happily watching, say, a favourite TV show, looking through a favourite book and that sort of thing. Then you go to, say, a cafe or a waiting area in a doctor's, you know, office. It becomes really, really challenging. Once again, I think what makes it easy, what makes it work in that first setting, and then what can we bring across to that other setting to help the child with that? There's no doubt in my mind, though, sometimes it is, and, you know, parents have taught me this, that it is lots of times, you know, different experiences, different kind of exposure to those situations, which are part of, you know, daily life. It can get easier over time. So it's easy to say, much harder to do.
Yes, indeed.
Continuing to kind of try and keep working towards that.
Thanks, David.
What about in terms of how do you work on flexible thinking? Well, this is a tricky one, and the answer might not be very helpful. It might be kind of helpful. My feeling is that the more kids are in different places and spaces and interacting with different people, the more the world kind of opens up to them. And I'm not suggesting for a minute that we throw kids into really tough situations and they just learn to, you know, to deal with that or adapt. Wouldn't be further from the truth. But the gradual opening of experiences and opportunities, I think that affects sort of their enthusiasm and their confidence in taking on different places. I think it actually flows through to flexibility in their thinking and how they approach situations. But I don't know, do you have any thoughts?
I couldn't agree more. I think, you know, one of the things that we know about very early childhood, so you think about infants and you think about, you know, young kids, part of the things that we're taught as parents more and more is that we need to encourage exploration. So, you know, and there's all these beautiful studies that show that when babies learn motor skills, so they're able to crawl, they're able to roll. I don't know if you remember those moments where you'd leave the baby in the room, go out of the room, and then you're like, where do they go? And they're rolled under the bed somewhere, you know. But actually, you see communication explosion after that because they're experiencing different things. It is very similar all the way through childhood. We need to extrapolate that all the way through. That flexibility, communication, emotional regulation comes through those different experiences. Now, of course, there's a balance, particularly for autistic kids. We do not want to throw kids into places they feel unsafe, places that they, truly takes them far too far outside the zone of where they are safe. At the same time, there is something to be said for taking kids to feel where, to experience discomfort occasionally. And again, this is not about sort of making them feeling viscerally uncomfortable, but to take them outside their comfort zone every now and then, to engage in those flexible ways of thinking, to have those experiences, to get home and feel a sense of accomplishment. Those greatest moments you have as a parent are when your child has an experience where they are feeling fear or discomfort, and then they go home and they feel that sense of accomplishment. That is the same in terms of flexible thinking, communication, and other areas of development. Again, what we're not saying is to put kids in a place where they feel unsafe or you feel unsafe. What we're saying is that different experiences are critical to help children grow and learn. And of course, that needs to be balanced with the unique needs and challenges and joys that your child experiences.
Yeah, I think beautifully said. It's sometimes a challenging message to get across. People can think, oh, you're suggesting something that's far from the truth. When we look at all kids and development and how they're growing, these are things about all kids that are really important foundations for their growth and their future, their confidence, and as much independence as possible. So, question here around PICA. What evidence-based therapeutic approaches for PICA and which type of service providers? So PICA is when people, children, young people, adults, they ingest non-edible items. And what I'd say for this one is it's really critical to think about what are the possible causes and to get professional help around this, because it's potentially very, very serious. It can be, of course, life-threatening depending on what that is that the person's ingesting. What will happen when you look at all the possible causes or you work with a good health professional, start with the GP, it's always a good place to start. They'll think about, could there be a nutrition factor here? So some children, for example, might put things in their mouth if they're low in iron, I understand. I'm not medically trained, but this is the sort of question that they'll ask. For other people, they'll ask if it might be that this person, let's say a child, is not really able to differentiate between edible and non-edible items, just like we see in all kids, at a young age. Sometimes that continues for some children as they get older. Another scenario, and this is quite common, there's a sensory aspect to it. So it's somehow soothing or feels, that it's helpful in some way. The key point is we have to, A, connect with somebody who really understands. B, think about all the possibilities, not jump to any conclusions. And then C, once we have a good understanding of the underlying reasons, we get some really nice, targeted, personalised support. So that's how I'd approach anything like this, where we're talking about potentially a medical or health issue. You need to really step through that.
Yeah, and I think just which type of service providers, the initial step is GP. This is really important to get medical advice around and have that medical home, your general practitioner, who can then refer you to the most appropriate practitioner, whether it be medical or otherwise after that.
Yeah, that makes sense. And the final one there was around selective eating. It goes by many different names. People talk about fussy eating and for so on. This one is one that constantly comes up. You find that in families, it really impacts on what is and can be and should be a really enjoyable part of any day, eating and drinking and oftentimes being together when you're doing that. I always take this one, like most things, I think about it in terms of all children and stages they go through in terms of exploring food, sometimes exploring a lot when they're really young and then narrowing. I'm in a narrowing phase with some of my kids. And then an expansion phase when you no longer, they really broaden. But again, just like you were saying in terms of kids being out of their comfort zone and so forth, same applies here. We want to think about what might be unique for some of our kids in terms of the reasons why they might be quite selective in the foods that they choose. Again, we go back to things like sensory differences, needs and also challenges that they may have with certain types of textures and tastes and temperatures, those sorts of things. So for this one, similar advice as before, GP from a nutrition health perspective. Then you might be thinking somebody who has good experience around thinking about the sensory side of things, but also the mealtimes side of things. So you might find a GP who can do all of those things. Sometimes they'll connect you with that, say, an OT for sensory side and maybe a speech pathology for the other. But we just step it through.
It is, and that's fantastic. I agree. It's both sides. Look, it is when you're fighting World War III 3 times a day, it governs your life, and I think we just want to say up front, it really we get that. We've seen it. Sometimes we've experienced it, but you know, when it goes on for years, it is very, very hard. And you start to look at your clock and you go, there's an hour to go until World War III again. It's very, very hard. But it is both sides. It is what can we do on the mealtime preparation side to make this go as smoothly as possible, and then what can we do on the child side to ensure that those foods are received in a certain way. So it is both, and of course, as you said, firstly it's the nutrition. We need to make sure kids are getting the right calories in and the right calories in, and then what can we do on the therapy side through OTs and others who can really support that. Right.
I love how you're picking up on that, because one of the things that I hear and see that's really hard for parents is all of the judgment and the opinions that they're exposed to, and sort of the critical appraisal. So, you know, how many times do you see a situation where a child is quite selective in their eating, and what do people around them do? They tell the parents what they could do better. You know, oh, you could just try this, you could hide it in that, or you could cut it up this way, or you could, and it's like, parents doing everything they possibly can.
You don't think I've tried that?
They know their child inside out, and they really don't need that additional advice. So if you find yourself giving the advice, please pull back. If you find that you're receiving the advice, you're right not to listen to it, and just, you know, work through the steps gradually. But yeah, it really frustrates me, the unnecessary pressure that is constantly put on parents.
Yeah.
Can we shift to schools?
Oh, do we have to? No, I'm joking. I love schools. Let's talk about schools. It's just such a big topic, and I could take the whole hour about this. So yeah, let's go.
Yeah, okay. So what should we cover? What's working well? What's not working well?
Well, I think we can say that. I think overarchingly we can say that the school systems are not necessarily designed for the kids that exist in 2025. Yeah. They're designed for the kids that exist in 1980 and before. And this is the way that we want it. This is the way that we want systems. We want them to be subject to inertia, because we don't want systems to be constantly changing year upon year, because we want people to expect the same thing. Right. That's a really important part of the health system, the education system, the disability system. We want some kind of consistency. In the context of schools, that inertia has probably left them quite a fair way behind to where the population is. The way that I sort of put it is that we have 21st century views of disability, particularly in the context of neurodivergence, that each child is beautiful how they are. It's not about changing the child, it's about supporting them to be who they are. Yep. With 20th century teaching practices and 19th century building infrastructure, it just does not fit. And the school systems that are closer to getting it right, no school system in the jurisdictions that I've seen is getting it right. The school systems that are closer to getting it right approach this with an element of humility that we aren't designed for the kids of today. And that's not our fault. They're just not designed that, and we need to constantly evolve. So the first thing to say is that the kids of 2025 are simply not the kids of 1980. We're experiencing higher levels of developmental delay, and so kids are getting to school not as ready as they were previously. There's a whole lot of factors that are driving that. And we have pressures on we have our pressures on the school system in terms of the demand for constricted supply. So again, our schools are getting bigger and bigger and bigger, but not necessarily more personalised. And then we also have our views and expectations that have evolved rapidly over the last 25 years at school that they're not necessarily meeting. And I think the other thing that we have to say is that schools are now the hub of their local community. I know that certainly that's the case the case of our kids, and we as parents expect so much more from school than they were ever designed to give.
Sure.
And so the expectations of schools is also higher. So schools are not meeting the needs of kids right now, particularly kids who have various aspects of neurodivergence, and then we need to evolve. And that is where we're at the point right now. How do they evolve? Ask me about that.
Yeah. I'm interested in your thoughts in terms of the people at the front line, teachers. What are you seeing from teachers? They're trying, right? And they're doing their best. And
teacher the heroes. I just think it's an unbelievably tough job at the moment. Teaching's it's a vocation. You rarely go into teaching, or at least stay in teaching for any other reason that you really love connecting with kids and their families. And teachers are fronting up day in, day out to large classes, classes that are really quite large, with kids who are more complex in terms of their needs than they were originally trained to meet, all the while trying to meet the expectations of 30 sets of parents. It's a really, really tough gig. One of the challenges that I see is that often, school systems recognise this, and we say, oh, the teachers need professional learning. They need to PL, they need to go and get more professional learning. I think that's part of the solution, but it's necessary, but it's in no way sufficient. That professional learning will only be effective when it is received within a system that enables them to act out. That means, time. That means smaller class sizes. That means a broader school environment, a broader system that enables the neurodiverse affirming practices that we know teachers want to be taught, are being taught, and want to enact.
Really well said. Really well said.
And just on that, I do want to say that I think school systems are also trying their best. There is no bad guy here. We're just working with large systems that were not designed for the kids that they're meeting right now. And the school systems that are doing well recognise that with humility and generosity and trying to evolve.
Thank you. One of the things that I noticed is that if you go on to run a Google search, or search it up, as my kids tell me I should be saying.
Right. Oh, wow. There you go.
Google things anymore. And I don't know if they even search it up, but that's 9 months ago.
Exactly.
Search autism, right? And you click on images and you see this kaleidoscope of different ways in which people are describing autism. All these beautiful, different conceptualizations of it. I see them as different ways, kind of thinking about and understanding and really valuing autistic kids and young people and adults and the way that they understand and interact with the world around them. And within this, I see different descriptions, just like we see in life more broadly. People might say, I'm an introvert, or I'm an extrovert, or I'm this or that. There's the term pathological demand avoidance comes up a lot, particularly over here in Western Australia. And I wonder your thoughts in terms of, I've had a question about pathological demand avoidance, and which is characterised by extreme anxiety and need for autonomy. How could mainstream schools and supports work with this way of thinking about autism concept? What might it look like?
Like all labels, it comes with a really good intent. What it is, it's an intent. The intent that behind it is to say that there's a whole group of kids who are really struggling, and also their families and support systems around that child are struggling and are needing support, and are also wanting to be seen. And providing that label essentially helps that. It says that, hey, here's a group of kids all showing relatively similar cluster of behaviours or profile, as we would say, and actually we need to actually turn our time, attention, energy to thinking about ways in which we can better support them. And I think that's what the value of any label is. And I know that speaking to advocates of pathological demand avoidance or persistent, was it persistent?
Demand for autonomy.
The demand for autonomy as
desire.
The desire for autonomy, which as it's been rebranded. I think that's what, and I know that's what they see as well, that this is a profile that needs greater attention, and certainly the labelling of it, particularly in the context of school, is thought about that. Hey, school system, teacher, principal, this child is showing this behaviours which has facilitated this research on this a bunch of kids. Can we learn from that to better support the kids? What's your view?
Yeah, I think I do agree with all of that. Like all the time, what we're trying to do is relate or convey or explain how this beautiful kid understands and thinks about and interacts with other people in the world around them, right? And parents are trying to capture that in a way that other people can then understand that child, value them, and best support them. And so I feel like different descriptions can be really helpful, but with one caveat. Sometimes we create, I think, a layer of extra complexity, which can actually kind of get in the way of transmitting or sharing or conveying that information. So what I'm talking about here is, within a class, there'll be kids with all sorts of different characteristics, profiles of strengths and needs and challenges. If I think about, my own kids' classes, there'll be kids with different diagnoses and descriptions and different ways of talking about basically their strengths, their needs, and how they kind of learn best and so forth. So I'm not saying don't use descriptions and so forth, but I think what we can do, if we want to give ourselves the best chance of conveying who our child is, how they understand, how they interact with the world and other people, what drives them, what motivates them, what their passions are, where their needs are, and the best way to support them. I tend to talk in really plain terms, the terms that anybody will understand, and find that common language, because that's when the real magic of the sharing and the back and forth happens. So yes, they serve a purpose, but sometimes I step back and think, what's the best way to connect with this other person who has a shared interest in supporting my child, and then talk and work in those ways.
Yeah, I think that's right. I mean, I love that, and you had some great examples, and that I've really learned from there. I wonder if we can now switch to talking about children with complex and high support needs, and so. Where, complex high support needs, level 3 autism, severe autism, there have been a whole lot of range of labels that have been used across the last 20 years. Some we don't use anymore. Where are we at with regards to terminology for describing kids with high and complex support needs, which I think probably relates to the previous topic we were talking about with regards to the labels?
Yeah. I guess we've both seen over the years that terminology has changed, right? We've moved from talking, there's still a whole range of ways that people talk about autistic children, children on the spectrum with autism and so forth. My sense is, we always go back to what's driving changes in terminology. And my feeling is the emergence of terms like profound autism, that's really come from a place of saying, hey, we haven't met the needs of a group of kids who have really involved disability. I see autism and disability as related, but not necessarily correlated or the same thing. So you can be autistic and you might have relatively low, or even in a particular time, place, no support needs. You can also be autistic and have profound needs, meaning you require supervision and support just to be safe, just to participate 24/7 around the clock, 7 days a week. And so this group of children and young people and adults with these really high, complex support needs, whatever term we use, I think the terminology is intended not to be divisive, but just to say, hey, we haven't done enough. We're not here, we're not doing what needs to happen to properly support these people and their families, loved ones around them. So I try not to buy into the debate of which term and, all of that sort of thing. Try to just focus on who are we talking about, what's their name, how old are they, where do they live, what are their strengths, what are their challenges, what do their family need, because when you have these very high complex support needs. It's a family that requires the support, not just the individual.
I love that, and I think it gets to the heart of it is that, you know, in the area of autism, we do see labels pop up. I mean, we talked about PDA. There's one that, you know, we've seen these across the journey, and the best thing to do is to engage with the reason and the values as to why they have come around. These have come around because there are people who are feeling that perhaps their needs have not been identified, and we engage with that. We engage with the needs. We don't necessarily need to focus on a label, and it's really important to other, you know, certain people, and that's absolutely fine. For us, what's really important is what is sitting behind the need for a new label, and let's focus on that need. So I really love that. Yeah,
I agree. What factors do you consider when working with, and so the terminology here, ASD level 3 clients, so talking about people, autistic people with really complex needs, and what evidence-based supports are available? Look, when I look at this question, I think about there was recently a national framework which was all around assessing and understanding children's strengths and support needs, and then how to support them. And that framework development process brought together a whole bunch of people from community and professional organisations, a lot of community consultation and review of evidence and environmental scan of all the knowledge around Australia and the world. And what it came back with were a number of things, but one of them was, when it comes to supporting people with really complex needs, and all children, in the case of, you know, young people and adults, we really have to make sure people are safe and they're healthy. We have to have those foundations, because on top of that, then we're in a better position for that person to be involved in more activities, to participate, and to kind of, you know, broaden their life and all of the opportunities. But we have to really look at that fundamental health and safety, and make sure that we're getting around individuals and their families in that regard. But also think about like key enablers. What makes a huge difference in a person's life? Communication is one of them. With communication, suddenly issues with safety become, you know, can be addressed or resolved or minimised. The opportunity for that person to influence their world and the people around them, their wants and their needs, to share what they see as important. All of those things are really important. Communication in all of its forms, speech, sign, gestures, communication devices, these things are of critical importance. To me though, and I'd love to hear your thoughts, a huge part of this is support for the families, because they will already know what's working well and what's not. They just need to be empowered and supported to do those things that they know working for their loved one, their child, the young person, the adult in their life. So that includes, you know, following their lead when it comes to thinking about different types of supports and practices, but it also means ensuring that they have the respite, the support they need to recharge, you know, to be at their best. So much energy, so much emotional energy and love goes into supporting someone who has really complex needs. And we have to do better at supporting those people, because we just have to.
Totally agree. I can't add to that other than to go back to the thing that I said before. It's not necessarily about what supports, but it's about the outcome. It's always focused on outcome. You know, what are we aiming to do? And as I said before, communication, emotional regulation, everything else. If a human cannot communicate their desires, their needs, their wants, and understand others, which is part of that core sort of, you know, strong core of what our drive as human beings is to relate to others socially. We're not going to be regulated. We're not going to be who we are. We're not going to be in that zone of learning. And then, you know, emotional regulation is going to go haywire. So we need to get that straight, and then everything else after that. And supports those two needs are going to be your enablers going forward. So, yeah.
I agree. The one thing that I think we've been saying, but not saying explicitly, is that when it comes to all of these supports, it's about the environment as much or more than the person, right? So when we think about a person with really complex needs and communication, first thought is, how do we support all the different communication partners in their life?
Absolutely.
Understand that person and really understand how they're communicating, in what way they're, and to get around them. When it comes to things like safety, we think, what can we do within the environment to support people with a loved one with complex needs, to make that environment as safe as possible? So think about the environment, the stairs. We change the stairs by putting a sheet on them. Think about the environment first, and then we think about how we can support that.
It's spot on. It's so interesting, and it's been such a step change, because that was what I was thinking all the way along, and it's sort of now just part of my lingo. That's exactly right. For a child who might be minimally verbal, in terms of supporting communication, communication, emotional regulation, everything else, supporting communication, it's about what can I do as a communication partner to make myself better understood? What modality can I use? How can I pronounce? What can I do? But it also, what can I do to better receive the message, or to interpret and understand the communication that is already coming from this beautiful young child? And so it's absolutely, what can I do first? That is spot on.
Beautifully put. I wonder if we might shift gears a little bit.
Yeah, let's do it.
Quick time check. We've got about 15 minutes to go. So we had a bunch of questions come in around sort of origins of autism, if you like, health, pharmacological interventions, complementary medicines, all of these.
Should I do 101 first on origins? Would that be helpful?
Yeah.
Let's do it. Look, it's so interesting, and I'm going to soak up a couple of the questions here, understanding, what are the causal origins of why kids develop differently, and are there relations to parenting? Are there relations to microplastics, the gut? All the gamut. So let me start with this by saying very clearly, what we do know is that autism is one of the most highly heritable neurodevelopmental conditions. Heritable meaning that it is inherent within the genes, that there are genetic factors that drive a propensity or a likelihood that a child is going to develop autism. Now, 25 years ago, we thought that we were going to find the gene, the single gene that was going to go on to cause the brain to develop differently, and children show the behaviours we used to diagnose with autism. But that's not what panned out. What we identified is that firstly, twin studies shows very clearly that autism is heritable. But then once we started to look at the DNA, we started to identify that there are dozens, if not hundreds, of different genes that increase the likelihood that a child's brain will develop differently and go on to show those behaviours that we use to diagnose with autism. So what does this mean on a practical level? What it means is that if we have 4 children coming to see us in a clinic, it's likely, if not certain, that the genetic factors that has caused that child to go on to develop or show those behaviours that we diagnose with autism are almost certainly different and very individual to that child. So how does the genetic factors then influence the brain? This is what we sort of do in our science. We sort of, okay, well, genetic factors are different. Then let's start to look at the brain. Maybe all these genetic factors change brain development in a certain consistent way. And actually, that's not the case. There has been dozens of studies, hundreds of studies that have looked at, are there differences in individuals' brains that are related to those behaviours that we use to diagnose autism. Looked at structure, which means the shape of the brain, the different sizes, the different sort of elements. Looked at the function, which means how do different elements of the brain talk with each other. And again, no consistent finding emerges. What we tend to think is at the moment is that the most likely scenario is that there are actually differences on a very, very small individual microscopic level with how the brain communicates with different elements. But again, that's not identified in all different elements, and it's certainly not to the point where this is used in diagnosis. And that, of course, all then goes down to behaviour, and that is where the commonality is that all individuals will show those core factors of social communication differences and restricted and repetitive differences. But then, as you know, and as we've been talking on the behavioural level, vastly different beyond that.
That's really, really helpful. I think we'll make sense of some of the answers that might be Can I challenge you to like a 10-second answer on some of these?
Oh, you got it. You got it. Okay, got 10 seconds for me. Oh, God.
And please don't think that being brief with these doesn't mean we're not taking them really, really seriously. We just want to work through a whole range of them. Are there any links between autism diagnosis and a lack of connection with that child's mother?
No, there's not. No, there's very clearly there is no parenting factor that goes on to increase the likelihood that child goes on to autism. Very much a genetic-based condition.
Okay. Any research on the influence of microplastics on brain development and autism?
There's a huge amount of research on microplastics, and there is evidence that microplastics on a very small level can influence brain development in relation to autism. And so this is why all of us are limiting plastics within our day-to-day lives.
This one, because it's good to explain.
So it's what we do have understood is that actually that microplastics, they're small, tiny little bits of plastic that chip off from everything that can have an influence on brain development. We've seen that initially through studies of animals. What we've now seen is to look at sort of population-based studies where children might be exposed to greater levels of plastic. Does that have an influence? And the evidence is now really mounting that it can have a very small influence, but it does have an influence. What the public health advice has been for at least a decade now is that how can we limit ourselves and in terms of exposure to certain plastics? So we know that our water bottles, for example, are now almost all BPA free, and so there's a certain chemical that we try to limit within the plastics. People often transition from plastic Tupperware to glass Tupperware. These are some of the things that have been public advice for a long time. Really importantly to say that none of these are deterministically causing. So taking microplastics or ingesting microplastics do not cause autism. What it's saying is that actually we do want to limit these within our diet, within our environment, because it's important for just general human health.
Yeah, terrific. And I was keen for you to take a little bit of time on that one, because the way that you approach it, I think, is the way we need to approach all of these different theories of why child might develop autism, be autistic. And so we've heard things recently, and we don't need to dig into them, but around paracetamol and pregnancy debunked, vaccines debunked, etc., etc. But it's important to know, I think, that when these things come up, just the way that Andrew's approached it in terms of thinking through all of that, what's a possible mechanism? Is it reasonable? What's the evidence? And we are,
And this is thank you, mate. I mean, I think this is the importance of science, is that if the evidence changes, we would be here talking to you about a different narrative. But we go on what the evidence says. And for all of these things you mentioned, clearly no evidence that they relate to a child being autistic. But at the same time with microplastics, that we appraise all of the evidence and make a judgment based on that. And so in terms of does microplastics cause autism and autism traits, no evidence for that. But we do know that there is evidence that microplastics taken in very high doses, beyond the doses that humans take, can influence brain development. So we do want to limit that for the betterment of human health.
Yeah, perfect. There's a question here around leucovorin.
Leucovorin. Yeah, absolutely.
I looked at the question is, are there any trials taking place? So we're fortunate in Australia to have the a clinical trials registry. So I thought I'll put it in there, just out of interest. Hundreds of responses, not in relation to autism. It's a drug used in support when people are having chemotherapy and so forth. So to my knowledge, in the Australian context, no trials in terms of the potential, could it offer some benefit for some children? That's a question for research. But
it's a question for research, and again, being intellectually honest, that there have been a couple of small trials that have looked at the effect of leucovorin on the behaviours and the cognition, the development of children, autistic children. And I have to say the evidence is pretty thin at this stage. Even the pilot studies were showing some effects, but not very strong effects, and the level of evidence is very, very low, and certainly nowhere near the level of evidence that will be used in clinical practice, because of we don't know the safety profile as well as obviously the actual effect.
Yeah, and that kind of segues or ties to, there's questions around supplements, for example, and other medications. And my feeling is GP, talk to the GP. They have the expertise. They'll take you through all of your questions, all of your answers. But the mainstay, the foundation of really good support for kids and families, we know what those things are. It's supporting learning, participation, and well-being in everyday activities. So that's where I put the emphasis and consult with questions.
That's exactly right. And yeah, go to a medical professional to talk about complementary alternative medicine as well as mainstream pharmaceuticals. And I think the framework you offered then was really important. So learning, participation, well-being, these are the things that are critical to kids. And sometimes medication, when kids are not on those paths for learning, participation, well-being, sometimes various other medications can be helpful to ensure that they have those things. And this is not us providing medical advice. This is sort of a framework through which you can make these really tough decisions. At what point is learning disrupted, participation and well-being disrupted? And that can help inform your decision.
Excellent. Look, there are a couple of questions around NDIS and thriving kids, and my feeling is that's really a whole seminar in itself. But I guess, if you're maybe three principles or, a small number of things that you would like to see in the development and design of the Thriving Kids approach.
Yeah.
Could you name just a couple?
I definitely can. Prompt access. Yep. I think that one of the things that the NDIS has been amazing. It's obviously had lots of challenges. What we need from the Thriving Kids reforms is to increase access, low threshold entry so kids can get access quickly. Number two, is let's bring supports back to community. Yep. That clinic-based supports are absolutely critical some of the time for some kids. How can we ensure that kids remain within their community and receive that support within the community where they live and play? That is how we best support people, kids. And the third one is one you said previously. How do we support parents? How do we support caregivers? Our greatest weapon in supporting kids is supporting parents. And how do we best build in those supports so those parents who are there day in, day out and have the greatest asset, their love for their child, how can we support them to deploy that greatest weapon to support their child in the way that's best for them?
Yeah, perfectly said. I'm not going to add to that. I think you captured three really important elements, principles, characteristics. And I might finish on this question. Maybe we can both offer some thoughts. I've probably got just a minute or two. I think it sums up a lot of what we've been discussing or brings it into one place. So one person wrote, I have an autistic daughter who is 7 and feeling the strain of misunderstanding all the social rules of year 1 at school. The older she gets, the more she is realising how different she is. And I'm watching her struggle and begin to blame herself. Negative self-talk and internalising already. What advice do you have for parents on how to keep them safe, healthy and resilient through the school years and learn to be okay with their differences? I think this, you can see all of the different parts of that, the love and care for the child where the child is, this little person is developing differently and she's starting to become aware of those differences. And the heartache it's causing in lots of different directions. What also strikes me with this is the approach the parents taking is to really understand and celebrate her for who she is and her differences. They make her perfect and beautiful and one of a kind. And I often say, if you want to have interesting adults, we've got to have interesting kids first, right? But one suggestion from my point of view, I think sometimes rather than focus on the differences in our kids and talking about those, we talk about the differences in ourselves and we create a space with our kids and our families where we can talk about our individual strengths and needs and differences in the way that we understand other people in the world around us, to help our kids feel like they're a part of a family who share, because they genuinely do genetically and in every other way, some of those same experiences. So talking about your own experiences, I think in your own ways, your own differences, and create that space where our kids can open up and talk about theirs and where things are easier and where things are harder because of that. Do you have any thoughts?
Oh, not beyond that. I think that's absolutely beautiful. I think that the more that we can find different ways to help your beautiful daughter understand how valued she is and how much she has to offer the world. I think that obviously messages coming from parents are incredibly valuable up until the age of about 9. And then you wonder whether it penetrates at all. But it does. It sticks in there. And the more that even when they feel like they don't fit, they fit with you as a family, that strong base will be the absolute core and heart of their resilience going forward. So if you can help them know that they are valued by you, that they have so much value to offer the world, and even when they don't fit or feel like they fit with you, I think that is the start. Now, of course, we haven't helped you with your immediate needs within the school, but hopefully we've said what is within your sphere of influence at home, and I'm sure you're doing that. But what we're saying is lean hard into that.
Beautifully said. Look, we're right at time. This has been a real privilege for me to work with these questions and have a conversation with you, Andrew, and really appreciate the opportunity. We'd love your feedback on whether this type of format is helpful, unhelpful, or otherwise. Honestly, we'd love to know, because our desire is just to try to be helpful. And that's Andrew and I, but that's our whole CliniKids team of clinicians and researchers and the whole group. All right, so there will be, this will be the last seminar. This is the last seminar for this year, but we'll be starting again in March 2026. And in a moment, the details for that seminar will appear on the screen. But for myself, thank you. Really appreciate the opportunity. Hope I've been helpful. Thank you, Andrew.
Me too. Ta-ra.
All right. Good night, everyone.